sleep is essential for our overall health and well-being. However, many individuals struggle with insomnia and other sleep disorders that can significantly impact their quality of life. For those seeking relief, diazepam, a medication belonging to the benzodiazepine class, is sometimes prescribed to aid with sleep issues. This video aims to provide a thorough understanding of diazepam dosage for sleep, its effects, potential risks, and important considerations for use. Diazepam, commonly known by its brand name Valium, is a versatile medication used to treat various conditions, including anxiety, muscle spasms, and seizures. Its sleep-inducing properties make it a potential option for short-term management of insomnia, particularly when associated with anxiety. However, it's crucial to approach its use for sleep with caution and under close medical supervision. As we delve into the intricacies of diazepam dosage for sleep, we'll explore how this medication works, proper administration guidelines, potential side effects, and important precautions. We'll also discuss alternative treatments and lifestyle modifications that can complement or potentially replace the use of diazepam for sleep issues. By the end of this comprehensive guide, you'll have a clearer understanding of how to approach diazepam use for sleep-related concerns safely and effectively. How diazepam works to promote sleep. Diazepam belongs to a class of medications known as benzodiazepines, which act on the central nervous system to produce a calming effect. When used for sleep, diazepam works by enhancing the activity of a neurotransmitter called gamma-aminobutyric acid, GABA, in the brain. GABA is responsible for reducing neuronal excitability throughout the nervous system, leading to relaxation and sedation. Mechanism of action. The sleep-promoting effects of diazepam are primarily attributed to its ability to bind to specific receptors in the brain, known as GABA-A receptors. By enhancing GABA's inhibitory effects, diazepam helps to reduce anxiety and racing thoughts that may interfere with sleep-onset relaxed muscles, potentially alleviating physical tension that can hinder sleep. Decrease the time it takes to fall asleep, sleep latency, increase total sleep time and sleep efficiency. It's important to note that while diazepam can be effective in promoting sleep, it does not address the underlying causes of insomnia. Therefore, its use for sleep should be considered a short-term solution while addressing any underlying issues contributing to sleep difficulties. Impact on sleep architecture. Diazepam's effects on sleep architecture. The pattern and structure of sleep stages are worth considering. Research has shown that benzodiazepines like diazepam can increase the amount of time spent in light sleep stages, reduce the time spent in deep, restorative sleep stages, suppress rapid eye movement, REM, sleep, which is important for cognitive function and emotional processing. While these changes may not be immediately noticeable to the user, they can impact the overall quality of sleep and potentially lead to daytime drowsiness or cognitive impairment if used long-term. Understanding how diazepam works to promote sleep is crucial for both healthcare providers and patients. This knowledge helps in making informed decisions about its use and potential alternatives for managing sleep issues effectively. Determining the appropriate diazepam dosage for sleep. When considering diazepam for sleep-related issues, it's crucial to understand that dosage recommendations can vary based on individual factors. The goal is to find the lowest effective dose that provides relief without causing excessive side effects or dependence. Factors influencing dosage. Several factors come into play when determining the appropriate diazepam dosage for sleep. Age. Older adults may require lower doses due to decreased metabolism and increased sensitivity to the drug's effects. Body weight. Generally, individuals with higher body weight may require slightly higher doses. Liver function. Since diazepam is metabolized in the liver, those with impaired liver function may need dose adjustments. Previous medication history. Tolerance to benzodiazepines can develop, potentially influencing the required dose. Severity of sleep issues. More severe insomnia may warrant a higher initial dose, though this should be carefully monitored. Presence of anxiety. If anxiety is a contributing factor to sleep disturbances, this may influence dosing strategies. Typical dosage range for sleep. While individual needs may vary, the typical dosage range of diazepam for sleep-related issues in adults is generally between 2 mg to 10 mg taken at bedtime. It's important to note that initial doses often start at the lower end of this range, usually 2 mg to 5 mg. Dosages may be adjusted based on response and tolerability. The maximum recommended dose for sleep is usually 10 mg per day. Elderly patients or those with compromised health may be started on lower doses, often 1 mg to 2 mg. Titration and adjustment. Finding the right dosage often involves a process of titration, starting with a low dose and gradually increasing if necessary. This approach helps minimize side effects and allows for careful monitoring of the medication's effectiveness. Key points in the titration process include starting with the lowest effective dose, typically 2 mg at bedtime, assessing sleep quality and any side effects after several nights of use, gradually increasing the dose by 1 mg to 2 mg increments if needed, under medical supervision, allowing sufficient time between dose adjustments to evaluate effects. Usually 3 to 7 days. It's crucial to work closely with a healthcare provider throughout this process to ensure safe and effective use of diazepam for sleep. Administration guidelines for diazepam in sleep management. Proper administration of diazepam is crucial for its effectiveness and safety when used for sleep-related issues. Following these guidelines can help maximize the benefits while minimizing potential risks associated with its use. Timing of administration. The timing of diazepam administration is critical when used for sleep. Take diazepam approximately 30 minutes to 1 hour before bedtime. Consistency in timing helps establish a regular sleep routine. Avoid taking diazepam too early in the evening, as this may lead to premature drowsiness and disruption of normal evening activities. Method of intake. Diazepam for sleep is typically administered orally. Swallow tablets whole with a full glass of water. Do not crush, chew, or break the tablets unless specifically instructed by your healthcare provider. If using liquid formulation, use the provided measuring device for accurate dosing. Duration of treatment. Diazepam is generally recommended for short-term use in managing sleep issues. Treatment duration typically ranges from a few days to 2 to 4 weeks. Extended use beyond 4 weeks should be carefully evaluated by a healthcare professional due to the risk of dependence and tolerance. Gradual tapering of the medication is often recommended when discontinuing use to minimize withdrawal symptoms. Considerations for special populations. Certain groups may require special considerations when using diazepam for sleep. Elderly patients. Lower initial doses are often recommended. Increased monitoring for side effects such as confusion or falls. Patients with respiratory conditions. Caution is advised due to the potential for respiratory depression. Close monitoring of respiratory function may be necessary. Individuals with a history of substance abuse. Extra caution and close supervision are required due to the potential for misuse or dependence. Pregnant or breastfeeding women. Use of diazepam is generally not recommended due to potential risks to the fetus or infant. Alternative sleep management strategies should be explored. By adhering to these administration guidelines, patients can optimize the effectiveness of diazepam for sleep while minimizing potential risks. Always consult with a healthcare provider for personalized advice and monitoring throughout the course of treatment. Potential side effects and risks of diazepam use for sleep. While diazepam can be effective in managing short-term sleep issues, it's important to be aware of potential side effects and risks associated with its use. Understanding these can help patients and healthcare providers make informed decisions about treatment and monitor for any concerning symptoms. Common side effects. Many individuals may experience mild side effects when taking diazepam for sleep. These often subside as the body adjusts to the medication. Drowsiness or grogginess the next day, dizziness or lightheadedness, confusion or disorientation, especially upon waking, impaired coordination or balance, dry mouth, blurred vision, headache, nausea, or changes in appetite. Serious side effects. While less common, some individuals may experience more severe side effects that require immediate medical attention. Severe drowsiness or inability to wake up, difficulty breathing or shallow breathing, severe dizziness or fainting, mood changes, including depression or suicidal thoughts. Memory problems or amnesia, allergic reactions, rash, itching, swelling, paradoxical reactions, increased anxiety, agitation, or aggression. Long-term risks. Extended use of diazepam for sleep can lead to additional concerns. Tolerance. The body may become accustomed to the medication, requiring higher doses for the same effect. Dependence. Physical and psychological dependence can develop, making it difficult to stop using the medication. Withdrawal symptoms. Abrupt discontinuation can lead to withdrawal effects such as anxiety, tremors, and rebound insomnia. Cognitive impairment. Long-term use may affect memory and cognitive function, particularly in older adults. Increased risk of falls and accidents, especially concerning for elderly patients. Potential for abuse. Diazepam has a risk for misuse and addiction, particularly in individuals with a history of substance abuse. Drug interactions. Diazepam can interact with various medications and substances, potentially increasing risks or altering its effectiveness. Other central nervous system depressants, e.g., opioids, alcohol, certain antidepressants, antihistamines, some antifungal medications, certain antibiotics. It's crucial to inform your healthcare provider of all medications, supplements, and substances you use to avoid potentially dangerous interactions. Monitoring and reporting to ensure safe use of diazepam for sleep. Regular follow-ups with a healthcare provider are essential. Report any unusual or severe side effects promptly. Keep track of sleep patterns and any changes in mood or cognition. Be aware of signs of dependence or tolerance. By being vigilant about potential side effects and risks, patients and healthcare providers can work together to ensure the safest and most effective use of diazepam for sleep-related issues. Remember, the benefits of treatment should always outweigh the potential risks. Alternatives to diazepam for sleep management. While diazepam can be effective for short-term sleep issues, it's not always the most suitable option for everyone. Exploring alternatives can provide safer, long-term solutions for managing sleep problems. Here are several approaches that can be considered. Non-pharmacological approaches. Cognitive behavioral therapy for insomnia, CBTI, considered the gold standard for treating chronic insomnia, focuses on changing thoughts and behaviors that interfere with sleep. Techniques include sleep restriction, stimulus control, and relaxation training. Sleep hygiene improvements. Establishing a consistent sleep schedule, creating a comfortable sleep environment, limiting screen time before bed, avoiding caffeine and large meals close to bedtime. Relaxation techniques, progressive muscle relaxation, deep breathing exercises. Meditation and mindfulness practices. Light therapy can help regulate circadian rhythms, particularly useful for shift workers or those with seasonal affective disorder. Exercise. Regular physical activity can improve sleep quality, best performed earlier in the day to avoid interfering with sleep onset. Alternative medications. Over-the-counter sleep aids, antihistamines, e.g., diphenhydramine, melatonin supplements. Prescription sleep medications. Non-benzodiazepine hypnotics, e.g., zolpidem, esopiclone, sedating antidepressants, e.g., trazodone, mirtazapine, orexin receptor antagonists, e.g., suvorexant. Herbal remedies. Valerian root, chamomile tea, passion flower. It's important to note that while these alternatives may have fewer risks than diazepam, they should still be used under medical supervision, especially prescription medications. Lifestyle modifications. Stress management. Addressing underlying stress and anxiety that may contribute to sleep issues. Techniques such as journaling, time management, and counseling. Dietary changes. Limiting alcohol and caffeine intake, avoiding heavy meals close to bedtime, considering foods that may promote sleep, e.g., tryptophan-rich foods. Environmental adjustments. Using blackout curtains or eye masks, investing in a comfortable mattress and pillows, maintaining a cool bedroom temperature. Technology use. Implementing a digital sunset by avoiding screens 1-2 hours before bed. Using blue light filters on devices if they must be used in the evening. Combination approaches. Often, the most effective approach to managing sleep issues involves a combination of strategies. Integrating CBTI with sleep hygiene improvements, combining relaxation techniques with short-term medication use, addressing underlying health conditions, e.g., sleep apnea, chronic pain, that may be contributing to sleep problems. When considering alternatives to diazepam for sleep management, it's crucial to work with a healthcare provider to develop a personalized plan. This may involve trying different approaches or combinations to find the most effective solution for individual needs. Remember, improving sleep often requires patience and consistency. While some strategies may provide immediate relief, others may take time to show their full benefits. The goal is to find a sustainable, long-term approach to managing sleep issues without relying on potentially habit-forming medications like diazepam. Conclusion. In conclusion, while diazepam can be an effective short-term solution for sleep issues, particularly those associated with anxiety, it's crucial to approach its use with caution and under close medical supervision. The appropriate dosage for sleep varies among individuals and should be carefully determined based on factors such as age, health status, and the severity of sleep problems. Understanding the mechanism of action, potential side effects, and risks associated with diazepam use for sleep is essential for both healthcare providers and patients. Proper administration, including timing and duration of treatment, plays a significant role in maximizing benefits while minimizing risks. It's important to remember that diazepam is not a long-term solution for chronic sleep issues. Exploring alternatives, including non-pharmacological approaches, lifestyle modifications, and other medications, can often provide safer and more sustainable solutions for managing sleep problems. Ultimately, the goal of sleep management should be to address underlying causes and develop healthy sleep habits that promote long-term well-being. This may involve a combination of strategies tailored to individual needs and circumstances. By working closely with healthcare providers and being proactive about sleep health, individuals can find effective ways to improve their sleep quality and overall quality of life without relying solely on medications like diazepam.